Over 6 million Americans live with heart failure, yet most don't recognize the early signs until it's dangerously late. That's because the body's warning signals are subtle, often brushed off as nothing more than normal aging, everyday stress, or simply being out of shape. But ignoring these signals can cost lives. Heart failure is a progressive condition. The earlier it's detected, the greater the chance of slowing it down, preventing complications, and protecting your future health. In this video, we'll uncover 13 silent signs that your heart may already be in trouble, signs that millions overlook every single day. Knowing them could mean the difference between early treatment and a medical emergency. Your awareness today could save your life. Number 1. Rapid weight gain from fluid retention. One of the most measurable and dangerous early signs of heart failure is rapid, unexplained weight gain. We're not talking about a slow increase from overeating or lifestyle changes. This is a sudden jump, 2 to 3 pounds in a single day, or 5 or more pounds in a single week, and it should never be ignored. When the heart weakens, it struggles to pump blood efficiently. The body interprets this as a drop in circulation and triggers hormonal changes that cause the kidneys to retain sodium and water. That extra fluid has nowhere to go. Instead, it builds up silently in your body, sometimes days before you notice swelling in the ankles, legs, or abdomen. The scale will show the warning long before your eyes do. Traditional weight gain from food is gradual and linked to increased calorie intake. But fluid-related gain appears suddenly, without changes in diet or exercise, and is often accompanied by bloating or a sense of heaviness. Unlike overeating, you cannot burn off this weight, it's trapped fluid stressing your heart. If you ever notice consistent, unexplained weight gain, especially combined with fatigue, swelling, or shortness of breath, it may be your heart's alarm bell. Doctors advise patients at risk for heart failure to weigh themselves daily, because the scale is the earliest and most reliable indicator of fluid overload. Don't dismiss it. Rapid weight gain is a red flag that demands immediate medical attention. Number 2. Nocturia, frequent nighttime urination. Another overlooked but important warning sign of heart failure is nocturia, the sudden need to wake up several times at night to urinate, often 3 or more times. While many people assume this is just part of aging, in reality, it can be an early red flag that your heart is struggling. During the day, gravity causes fluid to pool in your legs and ankles. If your heart is weak, it can't circulate this fluid effectively. When you lie down at night, gravity no longer holds the fluid in your lower body. Instead, it redistributes into your bloodstream, and your kidneys are suddenly flooded with excess fluid. Their natural response is to excrete it, forcing you to wake repeatedly to urinate. Frequent nighttime urination is often blamed on prostate enlargement, bladder irritation, or simply drinking fluids too close to bedtime. But heart failure-related nocturia is distinct. The urine volumes are noticeably larger, the pattern happens consistently, and it often appears alongside leg swelling, fatigue, or shortness of breath. If you are waking multiple times every night to pass large amounts of urine, and this is a new or worsening pattern, it's more than just a nuisance. Nocturia can actually appear before more obvious symptoms like breathlessness or visible swelling, making it a critical early sign. If this sounds familiar, don't ignore it. Discuss it with your doctor immediately. It may be your heart's way of warning you. Number 3. Night cough or wheeze when lying down. A persistent dry cough that worsens at night or when lying flat can be an overlooked but serious early warning sign of heart failure. People often dismiss it as allergies, asthma, or post-nasal drip, but in reality, it may indicate that the lungs are beginning to fill with fluid. When you lie down, fluid that has built up in your body during the day redistributes into your chest. A weak heart cannot pump efficiently, causing blood to back up into the pulmonary veins. This extra pressure allows fluid to seep into the air spaces of the lungs. The body responds by triggering a cough or even a wheeze as it tries to clear what it perceives as an obstruction. In some cases, the sputum may appear pink or white and frothy, a telltale sign of fluid accumulation. Allergy or sinus-related coughs usually improve with antihistamines, nasal sprays, or seasonal changes. Asthma coughs are often accompanied by a distinct wheezing pattern that responds to inhalers. Heart failure cough, however, is nagging, worse at night or early morning, and only improves when you sit upright. Traditional remedies rarely resolve it. If your nighttime cough is new, persistent, or accompanied by shortness of breath, swelling, or fatigue, it is not just an inconvenience, it is a potential red flag. A nocturnal cough that improves when upright should always prompt medical evaluation. Number 4. Palpitations or irregular pulse. One of the most unsettling early signs of heart trouble is the sensation of palpitations, a fluttering, pounding, or skipped heartbeat that seems to come from nowhere. Many dismiss these feelings as stress, caffeine, or anxiety, but when they happen repeatedly, especially at rest or when lying down, they can be an early warning of heart failure. A weakened heart struggles to pump blood efficiently. In response, it may develop abnormal electrical rhythms, known as arrhythmias. The most common is atrial fibrillation, where the upper chambers of the heart beat irregularly and ineffectively. This not only reduces circulation but also increases the risk of blood clots and stroke. In heart failure, arrhythmias and poor pumping function feed into one another, worsening the condition in a dangerous cycle. Occasional palpitations after coffee, nicotine, or stress usually resolve quickly and are not accompanied by other symptoms. In contrast, palpitations linked to heart failure occur more frequently, last longer, and may feel stronger, even when you are sitting still or trying to sleep. They may also come with fatigue, dizziness, or shortness of breath, which should never be ignored. If you notice your heart racing, skipping beats, or pounding for no clear reason, particularly if this happens at rest, it's a red flag. Combined with other symptoms like swelling or breathlessness, palpitations may indicate early heart failure or a dangerous arrhythmia. This sign warrants prompt medical evaluation before it escalates. Number 5. Dizziness or near fainting episodes. Feeling lightheaded, unsteady, or on the verge of fainting, especially when standing up or performing mild activity, can be far more serious than it seems. While many blame dehydration or inner ear problems, repeated episodes of dizziness may be an early indicator of heart failure. A healthy heart adjusts quickly when you change position or exert yourself, maintaining steady blood flow to the brain. In heart failure, however, the weakened heart cannot pump enough blood to compensate for these changes. This results in temporary drops in blood pressure and reduced circulation to the brain, producing dizziness or, in severe cases, complete fainting, also called syncope. Studies show that about 1 in 5 heart failure patients experience these episodes early in the disease. Dizziness from dehydration, low blood sugar, or sudden standing usually improves quickly after fluids, food, or rest. With heart failure, the dizziness tends to recur, worsen gradually, and appear even with mild exertion or simple posture changes. It is often accompanied by other symptoms, such as palpitations, fatigue, or shortness of breath. If dizziness or near fainting becomes frequent, or if you actually collapse, it is a red flag that your heart may not be pumping adequately. Do not dismiss it as just getting older or a little lightheaded. When dizziness is paired with other heart failure symptoms, it demands immediate medical evaluation. Number 6. Abdominal bloating, loss of appetite, or early fullness. Many people are surprised to learn that digestive discomfort can be an early sign of heart failure. Persistent bloating, nausea, loss of appetite, or feeling full after only a few bites are not always stomach problems. In reality, they may be the result of fluid buildup and poor circulation caused by a weakening heart. When the heart fails to pump effectively, blood backs up in the veins that drain the abdominal organs. This congestion affects the liver and gastrointestinal tract, causing swelling and fluid accumulation in the abdomen, a condition called ascites. At the same time, reduced blood flow starves the digestive system of oxygen, slowing down digestion and triggering discomfort, nausea, or a sense of fullness long before the stomach is actually full. Occasional bloating from overeating, gas, or food intolerance is temporary and usually relieved by dietary adjustments. In contrast, heart failure-related abdominal symptoms are persistent, progressive, and unexplained by diet. They are often accompanied by swelling in the legs, fatigue, or shortness of breath, key differences that point away from simple digestive upset. If you're eating less, losing weight unintentionally, or feeling full unusually quickly, it may be more than a stomach issue. These gastrointestinal signs are often overlooked by both patients and doctors, yet they can appear early in heart failure. If they persist, especially alongside other warning signs, seek prompt medical evaluation. Number 7. Bendopnea, shortness of breath when bending forward. A lesser-known but highly specific warning sign of heart failure is bendopnea, shortness of breath that occurs within 30 seconds of bending forward. Whether it's tying your shoes, picking something off the floor, or leaning over a sink, if these simple movements leave you breathless, it may signal a serious underlying problem with your heart. Bending forward increases pressure inside the abdomen. This pressure pushes upward on the diaphragm, reducing lung expansion and simultaneously raising the pressure inside the chest cavity. In a healthy heart, these changes are tolerated easily. But in heart failure, where filling pressures in the heart are already elevated, this added stress is enough to cause sudden breathlessness. Healthy individuals rarely become short of breath from bending briefly. At most, someone with deconditioning or obesity may feel a bit of pressure, but it resolves immediately once upright. Bendopnea, on the other hand, is consistent, reproducible, and specific to abnormal heart pressures. Importantly, it was first recognized in medical research in 2014, and studies confirm it is strongly associated with advanced heart failure. If bending forward, even for simple tasks, regularly causes breathlessness within seconds, it is not normal aging or lack of fitness. It is a red flag for elevated cardiac filling pressures and should prompt urgent medical evaluation. While rare in healthy people, bendopnea is common in advanced heart failure and is considered a reliable non-invasive clinical indicator of disease severity. Number 8. Cold hands/feet or narrow pulse pressure. One of the more subtle but serious early signs of heart failure is a noticeable change in circulation, persistent cold hands and feet, even in warm conditions, or a blood pressure pattern called narrow pulse pressure. These symptoms often creep in gradually, but they signal that the heart is struggling to pump with enough force. As heart failure develops, the weakened heart cannot deliver blood effectively to all parts of the body. To protect vital organs like the brain and heart itself, the body diverts circulation away from the extremities. This reduced blood flow leaves your hands and feet constantly cold, slow to warm up, and sometimes bluish in color. At the same time, a weak heart ejects less blood with each beat. This shows up as a narrow pulse pressure, meaning the difference between the top, systolic, and bottom, diastolic, blood pressure readings becomes unusually small, often less than 40 millimeters of mercury. Cold hands and feet from weather or anxiety improve with warmth or relaxation. Heart failure-related coldness is persistent, often accompanied by bluish nails or lips, and doesn't resolve easily. Narrow pulse pressure isn't caused by stress or temperature, it reflects reduced stroke volume, the very measure of the heart's pumping strength. If your extremities remain cold, take longer to warm, or show bluish discoloration, and especially if this is paired with fatigue or breathlessness, it's more than poor circulation. This is a gradual but critical sign of worsening heart failure and requires prompt evaluation. Number 9. shortness of breath on activity, exertional dyspnea. One of the earliest and most common signs of heart failure is shortness of breath during everyday activities, a condition known as exertional dyspnea. This isn't about gasping for air after running a marathon. It's about becoming breathless while climbing a single flight of stairs, walking across the room, or even performing simple household tasks that used to be effortless. In heart failure, the heart's pumping ability weakens. As a result, it cannot deliver enough oxygen-rich blood to meet the body's demands during physical activity. To compensate, the lungs must work harder, and you begin to feel winded quickly, even during light exertion. Over time, this shortness of breath worsens because the underlying problem is progressive. Normal fatigue resolves quickly with rest and does not usually appear after light tasks. By contrast, heart failure-related breathlessness is persistent, gradually worsening, and forces you to stop and recover even during activities that once felt easy. Unlike being out of shape, this symptom does not improve with regular activity, it only grows more limiting. If you notice that ordinary activities now leave you winded, or you've started avoiding movement because you run out of breath too easily, this is not just aging. It is your body's alarm system, and one of the earliest clues that the heart may be failing. Do not dismiss exertional dyspnea, it is your heart's cry for help. Number 10, orthopnea, needing extra pillows to sleep. A powerful but often overlooked sign of heart failure is orthopnea, the need to prop yourself up with pillows, or even sleep in a recliner, just to breathe comfortably at night. Many people assume this is a simple matter of comfort or habit, but in truth, it is a classic red flag of a struggling heart. When you lie flat, gravity no longer helps keep fluid in your lower body. A weakened heart cannot pump blood efficiently back from the legs and abdomen. As a result, blood backs up into the pulmonary veins, causing fluid to seep into the lungs. This congestion makes breathing difficult in a flat position. Sitting up or using multiple pillows reduces the pressure, making it easier to breathe. Some people prefer a pillow for neck or back support, but that is about comfort, not necessity. With orthopnea, the change is progressive. One extra pillow becomes 2, then 3, until eventually sleeping upright becomes the only option. Unlike reflux or nasal congestion, which may cause temporary nighttime discomfort, orthopnea reflects an underlying circulation problem. Orthopnea is present in nearly 80% of patients with heart failure, and it develops gradually. If you've noticed that lying flat leaves you breathless, or you've shifted from pillows to a recliner, this is not normal aging or habit. It is a critical sign your heart is under strain and needs medical attention immediately. Number 11, paroxysmal nocturnal dyspnea, waking up gasping for air. Few symptoms are as frightening, or as telling, as paroxysmal nocturnal dyspnea, PND. Imagine waking suddenly in the middle of the night, gasping for air, heart pounding, and feeling as though you are suffocating. Many mistake these terrifying episodes for nightmares, panic attacks, or sleep apnea, but in reality, they are a classic red flag of heart failure. During the day, gravity causes excess fluid to pool in your legs and lower body. When you lie down at night, this fluid re-enters the bloodstream. A weakened heart cannot handle the sudden increase in circulating volume, and pressure rises in the pulmonary veins. The result is fluid accumulation in the lungs, leading to sudden breathlessness that jolts you awake, often within 2 to 4 hours of sleep. Nightmares or anxiety may cause sudden awakening, but they are not typically associated with an urgent need to sit up or seek fresh air. Sleep apnea can also disrupt sleep, but it usually involves pauses in breathing and loud snoring, not sudden suffocation sensations with racing heartbeat. PND is unique in that symptoms improve only when you sit upright, allowing fluid to redistribute. Even one episode of waking up gasping for air should not be ignored. If these frightening awakenings are recurring, it is a clear signal of worsening heart function. PND requires urgent medical evaluation, it is your heart's alarm bell. Number 12. Fatigue and reduced exercise tolerance. One of the most common yet overlooked early warning signs of heart failure is persistent fatigue and reduced ability to tolerate exercise or activity. This isn't ordinary tiredness that improves with a good night's sleep. It's a deep, ongoing exhaustion that makes even the simplest daily tasks, walking, climbing stairs, or carrying groceries, feel overwhelming. In heart failure, the weakened heart cannot pump enough blood to meet the body's full demands. To protect vital organs like the brain and heart itself, circulation is redirected away from the muscles and less critical tissues. The result is poor oxygen delivery to the muscles, leaving them weak, heavy, and easily fatigued. Even after light exertion, recovery time is prolonged because the body struggles to restore balance. Regular fatigue improves with rest, diet changes, or reduced stress. Heart failure-related fatigue is relentless. You may notice that tasks which once energized you, like a short walk or gardening, now leave you drained and needing long rests. Over time, people unconsciously adapt by reducing activity, blaming age or lifestyle, when in reality it is a sign of declining heart function. If you are constantly exhausted despite adequate rest, or if everyday activities now require long recovery periods, this is not laziness or just getting older. It is your heart signaling distress. Fatigue that is new, worsening, and persistent should always prompt medical attention before the condition advances further. Number 13. Ankle, leg, or feet swelling, peripheral edema. One of the most visible and telling signs of early heart failure is swelling in the ankles, feet, or legs, medically known as peripheral edema. This swelling often starts subtly, your socks leaving deep impressions, shoes feeling tighter by evening, or a heaviness in the legs. Over time, it progresses, sometimes extending up into the calves and even the thighs. In heart failure, the weakened heart cannot pump blood effectively. As a result, blood begins to pool in the veins of the lower body due to gravity. At the same time, the kidneys, receiving reduced blood flow, respond by holding onto sodium and water. This combination causes fluid to leak into surrounding tissues, creating persistent swelling that worsens as the day goes on. Sitting or standing too long can cause mild puffiness in the feet or ankles, but this usually resolves with rest or elevation. Heart failure-related swelling, however, is symmetrical, progressive, and persistent. It does not fully disappear overnight and worsens daily, regardless of position. Pressing on the swollen area may even leave a lasting indentation, called pitting edema. If swelling is occurring every day, growing worse, or moving higher up the legs, it is no longer a minor inconvenience. Persistent, symmetrical swelling is a classic red flag of heart failure and should never be dismissed as just tired legs or aging. Seek medical evaluation without delay. Heart failure does not arrive suddenly, it builds slowly, leaving behind subtle yet powerful warning signs. From breathlessness and swelling to unexplained fatigue, dizziness, or nighttime cough, these 13 overlooked symptoms may seem harmless at first, but together they can reveal the heart's silent struggle. Recognizing them early is the key to saving lives. Protect yourself by performing daily self-checks, monitor your weight, pay attention to your stamina, and never ignore unusual changes in your body. Early awareness allows early action, and that can mean the difference between stability and crisis. If this video helped you, type heart in the comments, share it with your loved ones, and subscribe for more life-saving health videos. Your vigilance today could safeguard your tomorrow.